and you have a fever or a cough, and maybe you've just come in contact with someone who has COVID. So you take a test and then you get this, you get a positive result. What do you do next? That's what we're covering in today's To Your Wellbeing. Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder, is joining us. All right, so this is a common question, and with the rise in COVID-19 cases recently, a lot of folks may be in that position. So what steps should people do if they test positive?
Well, the first and foremost is definitely the key part of this is to stay at home, right? That isolation aspect of it. And like other respiratory illnesses, stay hydrated. You can take some medicines for your fever, and then also probably it makes sense to have all your housemates or household members also get tested. And if possible, they probably should quarantine as well, because there's a good chance that you may have already transmitted the infection to them.
So staying home is the key thing to do. First and foremost is staying home and quarantining. All right, so let's talk about like e-visits for COVID. How do those work?
So that's I think the great part in a strange way of this pandemic is that it's really pushed the medical field to figure out how to best serve patients in the community. And so I think if you're feeling poorly, where you're starting to have a cough, or you can't feel comfortable, I think you can get a lot of call your primary care doctors, see if they can do a virtual visit with you. And then also, especially if you have risk factors to having a worsening outcome where you need to be hospitalized, it's a good thing to call your doctor to see if you'd be a candidate for some oral antiviral medicine, or maybe a monoclonal infusion. So most providers know how to get you referred to the right clinic in order to be evaluated for that treatment.
All right, but let's say you don't have a primary doctor. So how do you sign up for an e-visit with Cone?
So if you go to conehealth.com, there is a link for doing virtual visits.
Okay, so there's a link there so that you can do that virtual visit. Now, does that virtual visit take place of a test?
I'm sorry, say that again?
Does that virtual visit take place of a test?
Oh, it helps you. So if you already have had your results or need a results, they can get you hooked up to get one.
Okay. And so then what steps should people take to prevent that spreading to others? I know we touched on it at the very beginning for like all the different things that you should do, but let's go over that specifically, because so many folks are going to test positive and have other people in the house.
Correct. So the first thing is that if that was my scenario, I would go home, wear masks, and try to be away from the rest of my family, and then definitely have my other family members get tested, and then also have like close contacts. If I've worked with anybody within 6 feet and not have my mask on, they would be also potentially exposed. The thing that's really hard with Omicron and COVID in general, the 24 hours or 48 hours before you had symptoms, your viral load is pretty high. To that point, that's how you can infect others. So you should try to also tell the folks you've been with within the last 48 hours that you may have exposed them.
Okay, so 2 days worth beforehand. If you had lunch with somebody 2 days worth, and then 2 days later you get sick, you need to call those people.
Yes, that would be the best.
Okay, so how long should folks anticipate having COVID symptoms? It's changed since COVID, the first generation of COVID was out. How long should folks anticipate having that feeling that they're not feeling well?
It really depends on the individual. So people who are vaccinated tend to have very mild symptoms and a shorter course of feeling poorly. So there are folks, and what's interesting about Omicron, it's really an upper respiratory infection. Like people talk about more having bronchitis, very sore throat, sometimes laryngitis, nasal congestion, headache, and some of them have fever and fatigue, but they generally can feel better. I think the majority of people are feeling better like within like about 5 days of having your symptom onset.
All right, so then what signs may indicate to folks that they need to seek additional medical care? Like, is it that longer than the 4 days, or is it other symptoms that they would need to probably see a doctor or do an e-visit?
So I think anybody that's having like worsening shortness of breath, where they feel pretty winded, with doing their regular activity, to me that suggests that that it may be more advanced for you, and that makes sense to contact your primary care doctor for evaluation.
All right, and are there any symptoms that would warrant immediate attention, like you need to call 911 if you're experiencing this?
Yeah, so definitely if people are noticing that you are really having shortness of breath, where you're having labored breathing, where sometimes we notice people, they're using their neck muscles to with a fast breathing rate. If they are not thinking straight, we notice people, if they're not oxygenating well, there may be some confusion. So all that. And obviously, if there's any loss of consciousness, and if you are having sometimes there's also a lot of GI scenarios with this too, where people are having a lot of diarrhea and some nausea and vomiting. If you're so dehydrated, I think all that really requires you to seek emergency care.
Okay. All right, so let's say you're not fully vaccinated or boosted, but you get COVID-19. Do you still need the vaccination and the booster after you've had COVID-19?
Yes, I think it's still a good idea, depending on where you're at. And that's the scenario of if you haven't had your booster and you get COVID at the time period where you're supposed to get your booster, it's still a good idea after you recover, you can then go ahead and get that booster vaccine of whichever vaccine that's available for you.
Okay, and I don't think you mentioned this. How soon after having COVID can you get that vaccine or that booster?
We suspect that you probably have immunity for 90 days, but I think in general, a lot of medical providers say that once you've recovered, you should probably get the vaccine.
Okay, gotcha. All right, so Dr. Snyder is going to be with us until 6 o'clock. And so from here on out, she is answering your COVID questions. You can ask your question anonymously and get your question answered on the spot. Here's how you do it. You text us that question. The number is 336-379-5775. We'll be right back.
Want your question answered? You've got to send a text message. Take out your cell phone and type out your question. Then send it to 336-379-5775. Don't call. You must send a text message if you want your question answered.
And we are back with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. She's answering your COVID-related questions. This question says, where can you go to a breathing clinic?
And so I believe that's in response to like a clinic just dedicated for respiratory illnesses. And there are some affiliated with Cone Health, but I bet you I've heard of other respiratory clinics with other health systems as well. And you might also just call your primary care doctor. I think a lot of them have realized the importance of seeing patients who recently have had COVID and may need to be seen.
Okay. This person is asking, after testing positive, do I need to see my physician for care, or can I just have a positive test and just deal with it at home?
So yeah, not everybody, actually, I think for the most part, not many people need to go see their primary care doctor specifically for having a positive test. It's, the folks that are most at risk for being hospitalized with this are those who are immunocompromised or who have a lot of health problems, those who are older, and especially if you are unvaccinated. So all that really are those some of the risk factors where you would seek care. If you are feeling fine and it kind of just feels like, a bad cold or a flu where you can just stay hydrated, stay at home, and lay down and relax and stay hydrated. Those are key things about getting over this.
Okay. All right, so the next question is, what's the latest on either COVID viruses being on food, packaging, mail, carry-out food, that kind of thing?
We've learned a lot of lessons over those last couple of years. And as opposed to the original strain of SARS-CoV-2, we don't believe that this is really transmitted through like packaging or fomites and such. So just continue with the 3 Ws. Hand hygiene in general is great, but you don't necessarily have to spray bleach or wash down any packaging that you receive.
Okay. That is something that has changed and that we have learned over the course of time, right? All of the science and the data is not going to stay the same. We're going to continue to learn things as we go through this. All right, so this next question is, I stopped having symptoms this past Saturday. How soon can I go out? And then they did say with a mask. So they know that they have to go out with a mask, but they're wondering how fast can they get out of the house if their symptoms stopped on Saturday?
Right. So, one of the most recent CDC recommendations was the isolation period for folks who get COVID. So, if you test positive and because of symptoms, you should stay home for at least 5 days. So, we say that you test positive, that next day is considered day 1. So you stay home for 5 days, and at the end of those, so the 6th day actually, if you are asymptomatic or very mildly symptomatic, you should wear your masks for the remaining 5 days, and then and continue to do things. But the safest thing is probably to stay home for 10 days.
Mm-hmm. All right, so this person says, if a patient had only the first vaccine, then they got COVID, how long are the antibodies and just the one vaccine going to protect that patient from getting COVID-19? I guess they're wondering, when do they need to get their second shot or their booster?
Yeah, so similar to be it if you had COVID-19 back in November or even in the beginning of December, you definitely did mount some antibodies through natural immunity, but we still recommend a booster vaccine. Probably as soon as you recover, or definitely like 3 months after the natural infection.
Mm-hmm. Okay. This question is, I should know this. My daughter and granddaughter both had COVID, but at what point is it safe for me to be around them?
So it is safe to be around them when they have finished their isolation period. So if they have been beyond 10 days, you can be around them.
Okay, so if they've finished their period of staying at home, that kind of thing, without those kinds of symptoms. Okay, this person says, will the booster injection render a positive for COVID on a PCR test?
So, yeah, I think that's a great question. So the vaccines should not interfere with any of your testing, be it antigen testing, the home kits, or PCR tests. So the only thing, though, is that we just want to make sure that when you go to get your vaccine, that you haven't recently been exposed or have a test pending during that time.
Okay, gotcha. All right, we're going to continue to take your text questions. The number right there at the bottom of your screen, 336-379-5775, and we'll be right back. All right, we are back with Cone Health's Chief Infection Prevention Medical Director, Dr. Cynthia Snyder. She's answering your COVID-related questions. This person says, can you give pets COVID if you have it?
I don't think that's the case, but I'm not totally sure.
Okay, that is good to know. All right, so then this next question is, who is eligible for the monoclonal treatments? So
the monoclonal treatments, they're not as conveniently to get as they were in the past because a little bit of a national shortage. However, just depending on your risk factors for severe disease, the monoclonal clinics evaluate you to see if you would be a candidate to receive it. And then if not, there are also other options. We have some oral antiviral medications that we can give out. So it's really important that if you have like diabetes, heart disease, lung disease, if you're overweight or have like immunocompromised illnesses, all that is super important to let your physician know that if you want to be considered for receiving a monoclonal infusion.
Okay. This person is asking, how can I tell the difference between a common cold, COVID, or whatever?
You know, that I wish that was, I had an answer to that, that would say yes or no, but there's a lot of overlap. And I think some of the delayed, diagnostics we have, or in the sense that we think it's allergies and then it ends up to being COVID. So the best thing is to get tested.
So if you wake up with a sore throat, you wake up with a cough, you start having all this drainage, you think to yourself, it's better to just do an at-home test and just find out right then and there. That's going to be your best bet.
Yeah, and even if your test is negative with the at-home test, making sure you should wear your mask wherever you go. And the key thing is that you may consider to go on ahead to getting a PCR test, since that tends to be a little bit more sensitive.
Okay, this person's saying, what if you're still having symptoms on day 10 and your antigen test is still positive? Can you go back to work with a mask?
Yeah, I think in that case, if you're still the key rule of that 5 and 5 days is that you're much improved or don't have any symptoms. If you're still having symptoms at day 10, that suggests that you're having probably a longer course of having a COVID illness, and I probably would not recommend you to go to work.
This person says, if you've tested positive for COVID, are there any over-the-counter medications that can ease your symptoms?
I think it really depends on which symptoms you have, but yes, I think a lot of over-the-counter medicines that you would take for a cold would also work for some of the symptoms that you have for COVID-19 as well.
For like the aches and the pains and the runny nose and the cough and that kind of thing, like what you would normally
take.
take.
So I think definitely you can do some of the like either Tylenol or ibuprofen if you're having fevers or body aches. So, depending if you have nasal congestion, some of the medications that you can find over the counter can help with that too. It just depends on what symptoms you're maybe having.
All right, and this last question, we've got about a minute left. If you were exposed today to someone who had COVID, but you've had all your shots, what should you do today?
So today, I still would wear a mask, and protect yourself and others, and then I would get tested in 3 days from now.
Okay, so wear your mask, still go to work?
You can go to work as long as you're not having symptoms, since you're fully vaccinated with that booster. And then get tested between day 3 and day 5.
Okay, great. Thank you for all of the information. As we know, things keep changing, so we bring you the most updated information and we get your questions answered. If you missed any of this information, you can find it on our website, WFMYnews2.com.